Welcome, friends. Today, we're going to have an important and honest conversation about something that might make you a little uncomfortable at first, but I promise you, by the end of this video, you'll understand why paying attention to this topic could actually save your life. We're talking about flatulence, or as most of us simply call it, passing gas. Now, I know some of you might be thinking about clicking away right now, but please stay with me, because what we're going to discuss today is information that every older adult needs to know. Let me start by saying this. Passing gas is completely normal. It's a natural part of how our bodies work, and every single person on this planet does it. On average, people pass gas anywhere from 5 to 15 times a day, though some of us might be on the higher end of that range. There's absolutely nothing to be embarrassed about when it comes to this normal bodily function. However, and this is the important part, certain changes in your gas patterns can be warning signs that something in your body needs attention. Think of it like a check engine light in your car. The car running is normal, but when that light comes on, it's telling you something specific needs to be looked at. As we age, our bodies change in countless ways. Our hair turns grey, our skin develops wrinkles, we might need reading glasses, and yes, our digestive system changes too. These changes are a natural part of growing older, but they also mean we need to pay closer attention to what our bodies are telling us. The digestive symptoms that we might have brushed off in our 30s or 40s deserve more attention now. What might seem like a minor inconvenience could actually be your body's way of waving a red flag, trying to get your attention about something more serious. Today, I'm going to walk you through 4 specific types of gas-related symptoms that should never be ignored, especially if you're over 60. We're going to talk about why these symptoms happen, what they might mean, and most importantly, when you should pick up the phone and call your doctor. But before we dive into those 4 warning signs, let me explain a little bit about why our digestive system changes as we get older, because understanding this will help everything else make more sense. As we age, our bodies naturally produce fewer digestive enzymes. These enzymes are like little workers in your digestive system, whose job is to break down the food you eat into smaller pieces that your body can use. When we're younger, we have an abundance of these workers and they're very efficient. But as the years go by, we have fewer of these enzyme workers, and they don't work quite as quickly as they used to. This means food doesn't get broken down as completely as it once did. When food isn't fully digested in your small intestine, it moves into your colon where bacteria get to work on it, and this process creates gas. Additionally, the muscles in our digestive tract don't contract as strongly or as regularly as they used to. Think of your intestines as a long tube that squeezes food along, kind of like how you might squeeze toothpaste from the bottom of the tube to push it to the top. When those squeezing motions slow down, food sits in your digestive tract longer, giving it more time to ferment and create gas. Many medications that older adults take can also slow down digestion, adding to this problem. Now that you understand why gas production changes as we age, let's talk about the first warning sign you should never ignore: a sudden change in the smell of your gas. I know this sounds a bit crude to discuss, but bear with me because this is genuinely important. We all know that gas can have an odor, and that odor can vary depending on what we've eaten. If you had a lot of beans, broccoli, or eggs, you can expect your gas to smell stronger because these foods contain sulfur compounds. That's completely normal and nothing to worry about. However, if you notice that your gas has suddenly become much more foul-smelling than usual, and this change persists for more than a week or 2, and you haven't made any major changes to your diet, this could be a sign that something has changed in how your body is digesting food. When food isn't being properly broken down and absorbed in your small intestine, it travels to your colon in larger, undigested pieces. The bacteria in your colon then work on breaking down these larger pieces, and this process can produce gases that smell particularly unpleasant, especially hydrogen sulfide, which has that characteristic rotten egg smell. Now, this might be happening because your body has developed an intolerance to certain foods that it used to handle just fine. Lactose intolerance, for instance, becomes much more common as we age. You might have been drinking milk your whole life without any problems, but suddenly your body doesn't produce enough of the enzyme lactase to break down the milk sugar called lactose. Another possibility is celiac disease or gluten sensitivity, which can actually develop at any age, even if you've been eating wheat products without problems for 70 years. But here's where it gets more serious. Sometimes persistent changes in the smell of your gas, especially when combined with other symptoms like unexplained weight loss, changes in your bowel habits, or fatigue, can be an early warning sign of colorectal cancer. I don't say this to scare you, but to emphasize why you shouldn't dismiss these changes as just a normal part of aging. Colorectal cancer is highly treatable when caught early, but the key is catching it early. The second warning sign that demands your attention is persistent bloating and abdominal pressure. Now, we all feel bloated from time to time, especially after a big meal or if we've eaten something that doesn't agree with us. That's normal. What's not normal is when you feel bloated most days, when your abdomen feels tight and uncomfortable even when you haven't eaten much, or when you feel like there's constant pressure in your belly that just won't go away. This kind of persistent bloating is your body's way of telling you that something in your digestive system isn't working the way it should. As I mentioned earlier, our digestive system slows down as we age. The muscular contractions that move food through our intestines become weaker and less frequent. This means gas can get trapped in your intestines instead of moving through and being expelled naturally. It's like a traffic jam on a highway. When everything's moving smoothly, cars flow through without problems. But when things slow down, you get backups and congestion. But persistent bloating can also be a symptom of several conditions that are more common in older adults. Irritable bowel syndrome can develop at any age and often causes significant bloating along with changes in bowel habits. Diverticulosis, which is the development of small pouches in the wall of your colon, becomes increasingly common after age 60. Small intestinal bacterial overgrowth is another condition that becomes more common with age. This happens when bacteria that normally live in one part of your digestive tract end up in your small intestine where they don't belong, producing excessive amounts of gas and leading to severe bloating. Here's what concerns me most about persistent bloating. People, especially older adults, tend to just accept it as part of getting older. They adjust their clothing to accommodate the bloating, they avoid social situations where they might feel uncomfortable, and they suffer in silence. But this isn't something you should just live with. Persistent bloating, especially when it's severe enough to affect your daily activities or quality of life, deserves medical attention. Now, let's move on to the third warning sign, and this is one you absolutely must take seriously. Gas that's accompanied by pain or cramping. I want to be very clear about this. Gas alone is normal. Even uncomfortable gas is usually nothing to worry about. But when passing gas, or the build-up of gas, causes pain, especially sharp or persistent pain, this is your body shouting at you that something is wrong. Pain is never normal, and it should never be ignored. There are several reasons why gas might cause pain. Sometimes when gas gets trapped in the bends of your colon, it can cause sharp, cramping pains that come and go. These pains can actually be quite severe and can even mimic heart attack symptoms if they occur on the left side of your abdomen. But if this is happening regularly, if you're experiencing painful gas several times a week, this isn't just bad luck or something you ate. This could be a sign of several conditions that need medical evaluation. Inflammatory bowel disease, which includes conditions like Crohn's disease and ulcerative colitis, can develop at any age, including in older adults. These conditions cause inflammation in your digestive tract, and symptoms often include painful gas along with diarrhea, sometimes bloody stools, weight loss, and fatigue. Diverticulitis occurs when those small pouches in your colon become inflamed or infected. This can cause significant pain, usually on the lower left side of your abdomen, along with fever, nausea, and changes in bowel habits. This is a condition that requires prompt medical treatment because if left untreated, it can lead to serious complications. Here's what I want you to understand. Pain is your body's alarm system. It's designed to get your attention and make you take action. When you have pain with your gas, your body is telling you something specific needs to be addressed. Don't take pain relievers and ignore the underlying cause. If you're experiencing painful gas more than occasionally, you need to talk to your doctor. If the pain is severe, if it's accompanied by fever, vomiting, or bloody stools, you need to seek medical attention right away. This brings us to the fourth and final warning sign, and in many ways, this is the most important one. Gas that's accompanied by changes in your stool, color, or frequency. I know talking about bowel movements isn't pleasant dinner conversation, but what comes out of your body tells a story about what's going on inside your body, and you need to pay attention to that story. Let's talk about stool color first. Normal, healthy stool is typically some shade of brown. The brown color comes from bile, a digestive fluid produced by your liver. But when your stool is a different color, especially if it's persistently a different color, this can indicate problems with your liver, pancreas, gallbladder, or intestines. Black tarry stools can indicate bleeding in your upper digestive tract, perhaps from your stomach or the upper part of your small intestine. This is a serious condition that requires immediate medical attention. Bright red blood in or on your stool usually indicates bleeding from your lower digestive tract, possibly from hemorrhoids, but it could also be from polyps or cancer in your colon. Pale, clay-colored, or grayish stools can indicate that bile isn't reaching your intestines properly. This could be due to a blockage in your bile ducts, problems with your liver, or issues with your gallbladder. These conditions need prompt medical attention. Now let's talk about frequency and consistency. Everyone's bowel habits are different. Some people go 3 times a day, others 3 times a week, and anywhere in that range can be normal as long as it's normal for you. But when your normal pattern changes, when you suddenly become constipated or start having diarrhea, this is something that needs attention, especially when it's accompanied by gas and other symptoms we've discussed. Sudden constipation in older adults can be caused by many things: medications, dehydration, lack of physical activity, or changes in diet. But it can also be a sign of a partial blockage in your intestines. Persistent diarrhea can lead to dehydration, which is particularly dangerous for older adults. When changes in your stool, whether in color, frequency, or consistency, occur along with changes in your gas patterns, bloating, or pain, this combination of symptoms provides important clues about what might be going on in your digestive system. Let me emphasize something crucial here. Many older adults are reluctant to talk to their doctors about digestive symptoms. They feel embarrassed, or they think these symptoms are too minor to bother their doctor about, or they assume it's just a normal part of aging. But I'm here to tell you that none of these reasons should stop you from seeking medical care. Your doctor has heard it all before. There is nothing you could tell them about your bowel movements or gas that would shock them. More importantly, what you might think is a minor symptom could be an early warning sign of something serious. Colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. But here's the good news. When caught early, it's also one of the most treatable cancers. The 5-year survival rate for colorectal cancer caught at an early stage is about 90%. The symptoms we've been discussing today can all be early warning signs. By paying attention to these symptoms and seeking medical care when they occur, you're giving yourself the best possible chance of catching any problems early when they're most treatable. I also want to talk about the emotional and social impact of digestive problems. When you're dealing with unpredictable gas, bloating, or bowel habits, it can significantly impact your quality of life. You might find yourself avoiding social situations because you're worried about having symptoms in public. You might not want to go to your grandchild's school play, or meet friends for lunch, or take that trip you've been looking forward to. This can lead to social isolation, which has serious negative effects on both physical and mental health. But here's what I want you to hear. You don't have to live this way. In most cases, digestive symptoms can be significantly improved, if not completely resolved, with proper diagnosis and treatment. Even when a complete cure isn't possible, there are almost always strategies and treatments that can help you manage your symptoms and maintain your quality of life. But the first step is acknowledging that something is wrong and seeking help. So what should you do if you're experiencing any of the warning signs we've discussed today? First, start keeping a symptom diary. Write down what you're eating, when your symptoms occur, how severe they are, and any other details that seem relevant. Note the color and consistency of your stools, how often you're having bowel movements, when you're experiencing gas or bloating, and whether you're having any pain. Do this for at least a week or 2 before your doctor's appointment. Second, don't minimize your symptoms when you talk to your doctor. Your symptoms brought you to the doctor's office for a reason. Trust that instinct and give your doctor all the information they need to help you. Be specific. Don't just say, "My stomach's been bothering me." Say, "I've had persistent bloating for 6 weeks. My gas has become much more foul-smelling, and I've noticed my stools are paler than usual." Third, be prepared for your doctor to order tests. Depending on your symptoms, they might want to do blood work, stool tests, or recommend a colonoscopy. I know the preparation for a colonoscopy isn't fun, but this test can literally save your life by detecting cancer or precancerous polyps early when they're most treatable. Fourth, be honest with your doctor about all the medications and supplements you're taking. Many medications can cause digestive side effects, and sometimes simply adjusting your medications can make a big difference in your symptoms. Finally, follow through with any recommended treatments or lifestyle changes. If your doctor suggests dietary modifications, give them a real try. If they prescribe medication, take it as directed. Sometimes people get frustrated when their symptoms don't improve immediately, but digestive problems often take time to resolve. I want to close with a message of hope and empowerment. Your body is an amazing, complex system that's designed to communicate with you. The symptoms we've discussed today are your body trying to tell you something important. By paying attention to these messages, by taking them seriously, and by seeking appropriate medical care, you're taking control of your health. Getting older doesn't mean you have to accept discomfort, pain, or a diminished quality of life. Modern medicine has so many tools available to diagnose and treat digestive problems. But those tools can only help you if you take that first step and ask for help. So, here's what I want you to do. If you've recognized yourself in any of the warning signs we've discussed today, if you've been experiencing sudden changes in the smell of your gas, persistent bloating and abdominal pressure, gas accompanied by pain or cramping, or gas combined with changes in your stool color or frequency, I want you to call your doctor. Don't wait. Don't convince yourself it's nothing. Pick up the phone and make an appointment. Your health is worth it. You are worth it. And if you're watching this video and you're not experiencing these symptoms, that's wonderful. But I still want you to take away an important message. Pay attention to your body. Notice changes. Don't dismiss new symptoms as just part of getting older. And most importantly, don't be afraid to advocate for yourself and seek medical care when something doesn't feel right. Before we end, I want to ask you to do something that could help other people. If you found this information valuable, please share this video with your friends and family, especially those who are in their golden years. Click that share button and send it to people you care about. You might just be giving them information that could change their life or even save it. And if you haven't already, please subscribe to this channel and turn on notifications so you don't miss future videos where we continue to discuss important health topics. Remember, seeking help for digestive symptoms isn't a sign of weakness. It's an act of courage and self-respect. It's you saying that you matter, that your comfort matters, that your health matters, and that you deserve to feel good in your body. So take that step, make that call, have that conversation with your doctor. Your future self will thank you for it. Take care of yourselves, and I'll see you in the next video.